this time I'd like to introduce our speaker. We're fortunate to have all the way from Alaska. We got him to come here all the way from Alaska. It's nice to have Hope Zonca with us. Would you please give her a warm welcome? Hang on. Hope's been in the healthcare industry for over 16 years. She's worked in multiple segments of the healthcare industry and held leadership positions for Johnson & Johnson and GlaxoSmithKline. She's currently a regional sales manager in healthcare IT for Greenway Medical Technologies, selling electronic medical records and health records. She holds a bachelor's degree in business administration with honors and credentials in Six Sigma practices, and I think that's why a lot of you are here today to hear about that topic. She sent me some notes ahead of time, and I just had to laugh. I had never really seen items like this before. Maybe they'll make you laugh too. We're going to hear about things like box whisker plots, run behavior charts. I like this one. It was about Fishbone Diagram. I don't know what this has to do with healthcare, but we're glad to have Hope here. And please take it away, Hope Zonca.
Thank you. Thank you. Good morning, everyone. Can you hear me okay? Can everyone hear me? Is this on? Okay, great. Good morning, Hank. Thank you for the warm welcome. I am very honored to be here and to have been asked by MOROF to speak to you guys today on Six Sigma and healthcare. We have all these trends coming up, right? We've got ICD-10, which, Hank, you ruined everyone's morning by bringing it up. So but it is a reality. Lots of things coming our way that really make us sort of juggle all the responsibilities that we have. Six Sigma is really just a way to help you sort of structure processes that are currently in effect or new ideas or projects that you want to tackle. So I am really excited to, and I know, Hank, you did a great job of introducing me. I really did grow up in Alaska. So I'm going to just go through the agenda. We're going to go, you guys already know a little bit about me, but I'll tell you a little bit more. Go through the fundamentals of Six Sigma and how does it apply to us in healthcare. Because it's not something new. Six Sigma's been around for a very long time, but grew up and originated in the manufacturing world. So then we're going to go through some guiding principles of Six Sigma. What's lean? What's Six Sigma? How do they differ? How are they the same? And then I'm going to share some examples and failures. What's worked, what hasn't, and why. And then we're going to do a quick exercise. Sound good? Excellent. So I know Hank introduced me somewhat, but something you might not know about me is that I have a minor in voice, which has absolutely nothing to do with our topic today. Other than I love to sing. I think I'd almost rather sing in front of a group, and I've sang in front of thousands, versus speak in front of 80 of you guys, but I love that too. I put a picture of my two children, Cole and Maddie, here because I also use scorecards and things within Six Sigma on them too. So they're always in trouble. But I can show you those examples as well. So little did you know that you can, who has kids here? Almost everybody, right? So when you leave here, you'll be able to create a scorecard for your kids too. Doesn't matter how old they are. So I am a wife, I'm a mother of two, I'm a leader, I'm a project junkie. I love numbers. How many IT folks do we have in the room? Who loves numbers? Don't have to be IT. Who loves numbers? My personality, you wouldn't know it, but I do because I seem like I'm very expressive, but I love numbers and I love digging into the data and I love to understand the root cause of what's going on in any situation. So I've worked for J&J and GlaxoSmithKline for the majority of my career. I started Six Sigma training at J&J over 10 years ago. So I am certified green belt, certified lean belt, and I'm black belt trained but not certified. So I'm very excited to share with you some of my teachings and projects and whatnot. Excellent. Okay, so Six Sigma, lean, kind of confusing, lean, Six Sigma, black belt, karate chop, brown belt, now there's brown belt. I mean, there's really all these buzzwords around lean Six Sigma and black belts and master black belts and whatnot. So I'm going to try to really simplify it for what is applicable to our industry, which is lean Six Sigma, and sort of help you understand the differences. So they really do have the same goal, to eliminate waste and streamline efficiencies, but there are differences in the way that they identify the root cause. So when you look at practitioners of lean, they really focus on unnecessary waste, and that's what they believe. They're proponents of believing that you don't have to spend as much time on the results, the metrics, and whatnot. Where Six Sigma, they really focus on the variation within the process. And I'm going to show you a little bit about that, but we're not going to dive into that too much today because what I've been studying over 10 years, we can't do in 1 hour, right? I'll try, though, really hard. So, what the truth of the matter is that when you combine both and you use them in tandem, that's when you really start to see great success, especially in our industry. And that is where the term Lean Six Sigma came from. So we're going to talk a little bit about digging into root cause, and know that although I can't cover everything today with you, I'm available to talk to you guys and share ideas and brainstorm after the fact if you guys would like to talk a little bit more about it. Does that make sense? That help sort of clarify the difference between the two? So Lean, not so much too many numbers. Six Sigma, all about the numbers. Great. So as I mentioned earlier, Six Sigma has been around a long time. Since 1986, was originated by Motorola, adopted by companies like GE. Jack Welch was one of the first to really make it a company-wide initiative where every level of the organization understood it. It was top-down leadership, and that's what made it most successful. That's what's going to make it most successful in our industry as well. So great examples out there. I've got some white papers and stuff I can share with you as well. So it's nothing new. What it really is a problem-solving methodology, a set of tools that help you organize your projects, help you structure them, and then measure them. And so it's in a nutshell, it really is a way to customize your projects to your practice, to your business. How many business owners do we have here, just to get an idea? Okay, so a lot of business owners. How many healthcare providers? What, even if you're at administration? Okay, great. So about half and half, I would say, right, in this room. So each one of you have different needs. Each one of you have a different culture. Each one of you, your dynamic is different. So if I said, you know what, I tried something Melanie shared with me over lunch one day for my business, chances are it's not going to work. But if I do my root cause and do my due diligence, then I'm going to do a project that's specific to my company, to my team, whatever it is that my objective is. So that's really what Six Sigma is about. It's a unique thing, practice to your culture, to your practice, to your office, to your environment, so that you can make it work for you and not try someone else's idea and say, oh, that was great, but it didn't work, failed miserably. Excellent. One other thing I want to say before I get off the slide is when you hear the word lean, what comes to mind? Efficiency, right? What do you think your staff thinks? Any hospital administration here, or head count reduction, right? That's exactly what they think. And that's why it's important, if you adopt Lean Six Sigma in your culture, you have to explain it to people. I think that's one of the biggest mistakes that people make in rolling out this initiative, is that they don't explain it. And so when people don't have the story, what do? They make it up. That's right. So then you've got cultural problems within your organization because didn't take the time to roll it out from top down. And you're going to hear me say that a lot because it's really critical. Even if you don't roll out an initiative, I think you'll pick up some pearls that will help you in your offices or your business. So it's not headcount reduction. It really is just a way to initiate bottom line change, efficiencies, and whatnot. Okay, so where are my number guys? Yeah, okay. Who loves statistics? Me. I do too. It's interesting because this process, Six Sigma, has been very effective in manufacturing because we've been able to, measure units, defects, and whatnot. Now in healthcare, it's a little bit more challenging, right? Because we don't have those hard, fast metrics that we're going to measure. So, but just to sort of illustrate and explain, you guys have copies of this as well. The term Six Sigma came from the different levels of Z. Okay, so if you look at level 1, for example, defects per million opportunities, the DPMO, 691,462. So if you look at the success yield of that, it's 31. That's not very successful, right? So the idea is that as you move through the levels, you get more efficient, you get stronger, you increase your efficiencies, you increase your bottom line, and things just continue to work easier, your processes and whatnot. So that way you don't have to think about, is it working? You've got the metrics and the hard and fast to communicate. So why now? I mean, Six Sigma has had sort of, in healthcare, this sort of growing, for lack of, it's sort of not sexy, but it's a thing to do. It's the thing that folks are looking at doing. So why now? Why do you think healthcare is looking at Six Sigma as a way to be more efficient? Absolutely. What else? What are some other things going on in our industry? Yeah, I know, like fast, right? Like really fast. We're going to talk about change management a little bit today too, because that's critical. So I'm going to give you the answers to the test too. It's all those things. It's changing really fast. One thing that's happened in healthcare for decades, we've sort of been ignoring the changes and sort of the emerging factors of what's happening in our industry. Sometimes it's just we're surviving, right? Because we have so much coming at us so fast that we are just weaving and bobbing and ducking and trying to make the best of everything coming our way. But there's increased competition, there's patient safety, increased healthcare costs, liability, Obamacare, malpractice insurance, all of that rolled up into one. So that's why Six Sigma, Lean Six Sigma, is much a hot topic right now in our industry. So what do you think, when you think about Six Sigma and healthcare, what do you think the number one challenge is, and why some people either don't want to learn how to do it or can't do it, or maybe why it fails a little more so than in manufacturing? What do you think that? Bingo. You are absolutely right. Hey, Hank or Chuck, we need to give her a prize. What can we give her? You're absolutely right. It's the I'll give you a prize later. So the you're absolutely right. It's harder to measure human element, the behavior. And who here wants to become an ACO? Who's put that on their radar? Anybody? No takers? Okay, so we know that there's certain things that you've got to measure, like patient satisfaction and things of that nature. But the key is with Lean Six Sigma is to leverage the data of human behavior. I can show you how to do that, probably not in this session, but if you've got an interest and you want to learn how to do it, I've got some templates and stuff that I've been a part of in projects and whatnot I can share with you and give you some ideas, some starting points. So, mentioned it earlier, but success only works when combined with a cultural strategy in healthcare. So if you don't have that sort of mind shift, then it's not going to work. So you've got to roll it out to your entire culture. So here's what I mean. This next slide is my favorite. So we're going to spend a little bit of time here. Everyone's got the change curve in front of them. Who's seen the change curve before? It's old too. Okay. All right, so maybe I'll teach you something new about the change curve today, because this one to me is really the piece that's going to make or break a project, okay? Doesn't seem like it, but it will help. Just stick with me here for just a little bit. It's simple and it's obvious, the things that I'm going to share with you, but I want you to envision this more in the shape of a U, and it is sort of in a U, like a V, and it gives you, how people are feeling and whatnot. On the left side of the curve, that's called depth, okay? That's when you receive the change. And so you'll see the little guy, can I cope? I have anxiety. Some people are elated. Oh gosh, it's about time. Things have changed, but they quickly go into fear. Depth is a place of denial. I can't believe this is happening to me. I can't believe we're doing this again. It didn't work last time. Why are we doing this? This is stupid. And we receive change on all different levels, professionally, personally. And some people can live in depth for minutes, seconds, years. They can live there forever, and that's a bad place to be, but it's important that you understand where your people at. It's important that you understand where you're at so that you can help yourself along the curve as well. So as you kind of move through depth, you go to the bottom of the curve, which is duration. duration can be equally bad, if not worse. And so, and you know these people. These are the folks that you give them the change, you roll out, Marianne, a new office structure, or Linda, and they're like, whatever, Linda's making me do it, so I'm going to do it, and I'm just going to fly under the radar, and whatever, I'm just going to do it. Okay, but that's a disillusionment phase, and some people just can't hack it, so they might leave, right? So you might have high staff turnover because they live in this place, they can live there for minutes, seconds, years, forever, and never come out of this change habit. So where you want your people to be, where you want to be, is in a place of acceptance. You want to be in a place of, I can do this, and I've got ideas, I've got solutions, and I want to help make this work, right? And that's where you want people to be, and that's the right side of the curve. So we want to get to the right side of the curve. Here's the kicker, is that everyone processes change differently, and it's that human element that's hard to measure, right? So you really got to meet your people where they're at. You got to understand where they're at. We're going to talk about that too. So the other thing that I want to point out about the change curve is that when, as a leader of your business or your office, your organization, of your family life, right, you have time to mull over your changes, your implementation or project idea, and you might have, Chuck, this great idea that you've been mulling over forever, and you've been working on your project and everything, and you've got this great idea. Now you're going to roll it out to your staff. And what do most people do when they roll out a new something, a new idea, how we're going to change our patient flow in the office, how we're going to do a business practice a little bit differently? They just tell you what's going to happen, right? There's going to be a meeting. Going to make an announcement. And everyone's like, oh, no. So, here it comes again. Oh, yeah, I got to go to that meeting. They're on the left side of the curve. They're definitely on the left side of the curve. So you've had time to process it, and this is the biggest thing that I see, especially coming from corporate America for the majority of my career, is that top leadership has had lots of time to think about it, to plan for it, get their marketing strategy together, and then they're going to roll it out to the field. They're going to roll it out to their peeps, and they're way on the left side of the curve, but they're expecting to jerk everyone over to the right side of the curve and make them like it, do it, and it's my business, and this is what you're going to do. So this is where you lose a lot of great talent and why things fail, right? And this is why I love this slide. It's so simple, but it, what's that? You never had a right side. I love it. I love it. And and it doesn't, like, I'm generally a very happy person. It is just my demeanor. It's just who I am. So acceptance doesn't have to look happy. It can just be, it can present itself in other ways too. So stylistically, yeah, if you're solution oriented, if you have, it doesn't have to be packaged the same way. But ultimately, you want to get yourself and you want to get your people to the right side of the curve, whatever you're doing, because it's going to help your company, your practice. It's going to help you achieve the goals that you've set forth and the objectives that you want to achieve. So does that make sense? Pretty simple, right? But pretty powerful too. So I'm going to ask that, when you think about where you might be when something comes your way, where are you on the change curve? If you're a leader within your organization and you have direct reports, then find out where your people are on a particular topic. Can't throw 10 things at them and say, where are you at on this and that? But when you're rolling out an initiative, this is a great place, a great thing to explain to them, because then they can understand where they're at. Maybe they're, always the negative Nelly that's bringing everyone else down. And so this is a great talking piece and management tool to help with your staff as well. You like it? Awesome. Good. Okay, so this is more informational. I'm going to share with you two basic types of projects and flow that you would use within Six Sigma. We don't have the time to fully go through a complete project scope and really drill it down. I've got examples to share with you, but what I wanted to do was really explain the differences. So there are two types of project setups. One is DMAIC, define, measure, analyze, improve, and control. DMAIC is designed to improve existing processes. So if you have, let's say, for example, you want to reduce your wait time in the waiting room. So it's now currently, you've got to measure it, and so now it's currently 30 minutes, but you want to get it to 5 to 10 to improve patient satisfaction, right? So you've got, this is something that's already in place, but you want to improve it. So then you're going to walk through the process, you're going to analyze, you're going to improve it, and you want to control it, and you're going to measure it. With Fishbone, where's Hank? Oh, yeah. I'm going to buy you fish for lunch. So that's the difference between DMAIC. And this one, my professor would say it, but I just can't do it. It's DMADV. Okay, so if someone can say that really fast, I'll give you a prize as well. But the main difference is that, so this is a new project. So if you want to design something new, you've got an idea, a need for your practice, for your business, then you would use the DMADV process. The main difference is in the design and verify. So, you'll use tools like Fishbone, process flow diagrams, stats, of course, control measures. But in this, when you're rolling out a new project within your business or your practice, you've got to be able to adjust ongoingly, do root cause analysis, and be able to adjust in the middle of your project. Okay, so it's important to have your cadence calls, your meetings and whatnot to ensure that you're tracking whatever you're measuring within the project. There's lots of things that you can measure. Who can think of some things that you would want to measure in our field? I didn't hear.
Who's asking the question?
There. Absolutely. 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 I've got some great examples. What was that?
Reduce infections.
Absolutely. That is definitely a good one. What else? Any ideas? Absolutely. I heard another good one back there.
Help desk response. Help desk response.
Absolutely. Absolutely. We measure that at Greenway. Absolutely. What else? Oh, yeah, you can absolutely measure that. You can almost measure anything. There's a way to almost measure everything. So, excellent. Good, good. If you guys want to see some more examples around these two model setups, let me know, and I can provide you some templates and whatnot to start your next project. Any questions on DMAIC or DMADV before I move forward? None? It's a quiet group. You guys need more coffee. Go ahead, get up, more coffee. I'm flying through this presentation. All right, so, and I really am. So let's talk about some of the success stories. I didn't know how much time we would have, so I just had a couple. And certainly, is anyone here using Six Sigma in their practice or hospital? Anybody? I know I talked to a few of you this morning when you're getting breakfast. And who's rolled out a Six Sigma project or Lean project?
I came late in the game to a Lean project.
Yeah.
At Winter Haven Hospital.
Okay.
There's a lab space, and they actually got funding for the lab project because they went through the exercise of Lean.
Yep. Hello.
I was just talking about a project that I was doing at a lab. They got funding for the project because they went through the Lean exercise. They were able to show the efficiencies and where they were saving the money.
Yep.
And the hospital agreed to allow them to use that money savings to revamp their lab space to make it more efficient.
Oh, fantastic. And that's fantastic. Hank, just don't get near that speaker, okay? Excellent. Well, as you guys know, especially those from the hospital setting, it is most hospitals, I would say in the Orlando market, and I moved away for a year and a half, but as I was leaving, most of them were adopting Lean Six Sigma within their hospital systems, mostly on the administration, C-suite, nursing staff, doctors, not rolling out fully, but I'm interested to follow up with some of my contacts and see how their projects have gone and whatnot. And if you guys hear of anyone, your customers, it's great to share successes, because I think that's how we also get better as an industry, is to best practice share. That's a key critical component in projects as well. So this is an older example, but it's still ongoing. Mount Carmel Health Systems in Columbus, Ohio, they're a 3-hospital system with over 7,300 employees, 1,200 physicians. At the time, they were having financial problems and challenges, rather, and they knew that they had to do something about it. So they brought on a team of black belts. So black belt is your highest certification. Master black belt actually is the highest to sort of oversee everyone. In a project, you've got to have a green or a black belt to really be successful. That's your project champion. Lean belt, it can do it, but if you're going to roll out a big initiative, you really want a black belt or a green belt. Sorry, I just swallowed wrong. I always do that. So they went on to hire 44 black belts and really put a lot of money behind this. But to date, they've increased their bottom line by $3.1 million, and actually it's ongoing because this example is old, and I wanted to bring something that, and I have to share the exact facts of it. We talked a lot about this when I was training in my black belt class. And so we also talked conversely about projects that failed and why. So Red Cross rolled out a project as well. They didn't have the top-down buy-in, so senior leadership did not buy in. So what do you think happened? It just was a little bit of a waste of money. So it's important and it's hard, because as leaders, and I see a ton of leaders in this room, all of us are leaders in some way, and it's interesting because we, in salespeople, we're the worst, because we think our ideas are great and we got the best solution and whatnot. But right, never, not me. So if in this particular example, they realized that they were going in the wrong direction, and so they readjusted and they came back and they made. They rectified their mistakes and were able to see a return of $440,000 and ongoing. But their initial gain wasn't that of Mount Carmel Health System, because they didn't have top-down buy-in. And so that's the key critical part, is to really embrace it and understand where folks are on the change curve, and have your yourself and your leaders trained and have a good understanding of where folks are at. It'll help your projects go that much smoother. So that was, and I've got some from the sales, and I thought about today sharing some of my projects that I've led personally in my Greenbelt project. I can share that with you afterwards if you have questions, but it was very on the sales side, so I didn't feel it appropriate to share with you guys today. But the fundamentals of the project setup and everything, I think, are a good thing to share if you do have more questions and whatnot. So the next few slides, and Chuck, how are we doing on time? Okay, great. Are really, as I prepared for this presentation, when Chuck asked me to speak to you guys today, I didn't know the audience. I didn't know who was going to be here, what levels of exposure do you have to Six Sigma, so I wanted to make it very fundamental. At the same time, I wanted to provide some tools that you could leave with today and go back to your office, go back to your practice, wherever that might be, and use these tools today. So you don't have, it's not an all or nothing thing, although a project in and of itself, and any project management person would say do everything soup to nuts, because you'll have the end result that you want. But doesn't mean that you have to do everything to start to initiate change in your office. It can be simple. So as I was preparing, I thought of things that would help you leave today and try something new in regards to project management in your unique situation. So One is, and I've got, Chuck, I emailed this to you. It's an 8-page white paper that I got in school, just around the 5 secrets of project success. And it's PITA, so another acronym. Project planning, identifying detail requirements, really breaking down the work structure, exhaustive risk management, development of the project team, that's key critical. So if you know someone, even though you think ideally they're the right person to put on because they've been there longer, but you see someone that maybe doesn't have their tenure, but they have those leadership qualities, give them a chance. Help them grow and develop as well. And then an organizational culture for project management or Six Sigma. So I'm going to just let you, give you that article if you would like it. Okay, so everyone here's heard of Colin Powell, right? So many years ago, I got the privilege of hearing him lecture. So inspiring, because he, Colin Powell is just a very unique leader, and he really says it like it is, right? So this rule is interesting. And who's heard of the 40-70 rule? Yay, I've got an audience that's not heard. I get to teach you something new today. This slide, actually, I had set up wrong. So I'm just going to put it all out there. So Colin Powell talked about in his lecture, he had so many different principles and whatnot, and I think this one was lesson number 15 to live by. And so often, as leaders of your organization, even making just any decision, personally or professionally, it can be difficult because you fear you might make a mistake. Maybe I'm going to buy that wrong house, or maybe I'm going to send my kid to the wrong school, or maybe I am going to hire the wrong person. So a lot of people, when decision making, they wait till they have 100% of the answer, right? Because they want to do their due diligence, they want to do their cadence, and they wait too long, and the opportunity passed them by. Or business owners, how many times do you have a great idea and someone stole it, you're thinking about it, you're like, darn it, I had that idea, why didn't I act on it sooner? So here's the rule to live by. If you have 40% of the information, it's not enough. Keep going, keep digging, keep doing your due diligence. But anything over 70% is too much. So when you have 70%, so between 40 and 70% of your cadence, your due diligence, act. You might not have all the answers yet, and that's when you do your root cause, your cause effect, those things within your project. But when you've got 70% of the information, go for it. And explain that too to those that you're leading, because it's important for them to know that you might not have 70% or 100% of everything you need, but you're going to figure that out by doing certain things within the next few months or weeks or whatnot, to make sure everything is perfected. Isn't that pretty? It's interesting, and when I first heard this, I really thought about it long and hard. I'm like, wow, I've missed so many opportunities in my life because I didn't act quick enough. I needed more answers. So, excellent. Sure. Yeah. That is, that's great, because actually, Colin Powell's lesson is not part of Six Sigma per se, but I threw it in there because I think it's something that's relevant to what it is in project management and decision making, because it's all about, project management is decision making, right? It's ongoing decision making. So I guess it depends on what you're trying to measure. If it's patient satisfaction, you can't please every customer or every patient, or every customer. So you have to have enough of the information to make the next decision or come up with the next solution. I guess it would depend on what you're measuring, because and what stage of the project that you're at. Yes. Absolutely. Absolutely. Yep. I can show you some examples too of, as a sales leader with my team, how I would measure certain things and give you an idea and just maybe get some mental popcorn going on how you might measure something that you want to do or achieve. So that is a great question though, but this is not part of Six Sigma. I just love it because because I think it's good wisdom to live by. It's a good rule no matter what, be it personal or business. All right, so where's Hank? Hank, there's your fish. This is another sort of, you got to have some, and there's lots of different ways to measure continuous improvement or quality improvement. This is just one of many. Most organizations use Fishbone because it is, the dialogue around Fishbone just seems to really work better. So ultimately, it just helps you identify the root cause with a thorough explanation of the issue behind the problem versus just somebody, I know what the problem is, so-and-so didn't do their job right. Well, when you fishbone it out, you're going to see what really happened and do it objectively, and the result's going to be a more robust solution versus just, your opinion. And it'll be facts driven. Do we have a question back there? No questions? No, not yet. Okay, great. I love it. Okay. Who here has ever watched Undercover Boss? I love that show. I cry every time. No. Undercover Boss is a great example, and for those of you that haven't seen it, CEOs and executives, they go undercover to work, and they change their hair and the look, and they go out and they work with their people. And they understand what's going on. What are they faced with, their challenges and whatnot. That's Gemba. Gemba is really, it's a Japanese meaning for the real place. So where you really understand what's going on, how you ask questions. And you can Gemba, even if you're a one-person business, you can Gemba your customers to really seek to understand what's going on in the work, ask questions, learn. The important thing about Gemba is that when you are trying to seek to understand, you can't offer solutions. So instinctively, you want to give ideas because you have all these great ideas, but you have to keep it shut, and you just got to listen. And that's the hardest thing to do when you're trying to roll out and understand what's broken and how do you fix it. You got to just listen, and it's really hard because as humans, depending on your social style too, you just want to provide solutions and feedback. So no feedback's allowed during Gemba. So Gemba Kaizen, and people use it in our Six Sigma project management world. Individually, they use it together. Kaizen is really continuous improvement. It's change in the behavior. It's also measured. So I'll show you some examples too of how you can measure and if you're on track, if you're not on track, and red light, green light. Those are also hard for people to swallow, but it isn't negative. It is just how we measure in this world. So they go hand in hand. Scorecards is really what it is. So to have some sort of scorecard to measure, are you tracking? Do you have all the information enough to make the next change? Okay, I am glad I put this up. Hold on. So if you haven't watched Undercover Boss, go watch it because it'll give you some great perspective. All right, I.P.O. For my IT folks, this has nothing to do with IT. Okay, so who's ever gone to a meeting and there was no agenda, there's no really thought, you're just kind of winging it? Anybody been to one of those? I go to them all the time. Yeah. So, I'm going to show you an example of an I.P.O. where you can have a tight meeting and meet your objectives for that meeting. It's input, process, and output. And so ultimately, you want to gather your input and start with your input, have your desired output, and the processes it's going to take to get there. And so you can do I.P.Os in lots of different ways. I'm going to show you. Oops. Let me show you one that I did for my team. So this, again, is on the sales side, but every week I'd have cadence calls, and this is a leadership one. But I knew what was going to take place on those calls or meetings, and I'd always put one together just like this because it was also an agenda. So it's an agenda and it's an I.P.O. So you've got, or whatever business meeting that you have, nurses meeting, staff meeting, then everyone's on the same page, and you're able to have a more effective meeting and leave. Everyone will leave there like, wow, Mary Ann put together this awesome agenda. I feel like it was really efficient. What a great way to start my day. So, but also as the practice manager, you're able to come back with great data that's going to help you have a more efficient, well-run office. So all of these are available to you, and I've got tons of examples. We talked a little bit about enabling and driving change, and this was one that I did for my team where, ultimately I wanted to understand engagement. So we were trying to understand, how do we engage with our doctors, how do we engage with our staff, and then to measure that, and we did, so in different behaviors and whatnot. So collaboration, communication, accountability is key critical to any successful project. So you got to measure something, and you got to be accountable. So this, that it's not all fun and smiles. I mean, you've got to be able to measure and hold people accountable to the tasks that they've been assigned to do and their job responsibilities. So build an accountability mindset, take actions as things aren't happening. So what happens if it's the cause and effect? So what happens if we don't meet our measure? What next? So is that helpful? Anyone going to use the new I.P.O. for their next meeting? Yeah? Excellent. Show of hands. Yay. Good. Excellent. Okay. All right. We've already kind of done this, but I just want you guys to take your notebook and think about individually what project you want. And I think Chuck put out notebooks for all of you to on the tables, but think about what you might want to do, what project you might want to work on. It's if you want to improve something within your business, your practice, your hospital, or maybe a personal goal, and if you want to buy a house or whatnot, write it down, because I think that's the first step in any great project, is to start to get the stuff on paper and start to, even as simple as it is, your thoughts, when you put it on paper, they become that much more real, and then you start to dig in and flesh it out. Melanie, I don't see you writing. I'm just kidding. I can. That's right. You didn't. Wine. Okay. Just kidding. I did not say that. Edit that out, John. Okay, great. All right. So now the floor is yours. I know we've had some questions along the way. What questions do you guys have? It's been a fun group this morning, especially this early.
Realize I'm coming around with the microphone, so give me a few moments.
Getting back to your diagram where you had the beginning and the end and the anxiety and all that.
Yes.
When top-down management puts in new things and says, okay, it's time for us to change everything we're doing, take off and go, what is a reasonable time frame to give them to take off and go?
I think it depends on how much information they have. So if you have an example, I think you got to, how many people are in your staff? So if you roll out 14, okay, 13. So you've got 13 personalities versus someone who might have 2 or 3. I understand your pain. It can be quite challenging. I think information is king, because when they don't have information, then they start to make it up, and then everything can fail. So that initiative that has to be done, so we meet our measures, so all the things that we're held accountable to in our industry, we have to meet those measures. It's non-negotiable, but how we get there is negotiable, right? So I think if you give them information, you explain why, and I think that's the key word is why. And that's all in Fishbone too, the 5 whys, but why you're doing it, and help them, and then set a time. So ultimately, you may not get everyone to the right side of the curve, but if you explain the curve to them, and you have if maybe it's one person of your 13 that's bringing the rest of the team down, as a leader, you want to identify that one person, and then maybe have a conversation. Say, you know what, Hope, I really I really remember we talked about the change curve and where are you at? You know, instead of telling them where they're at, you know where they're at, but say, where are you on the curve? Are you over here? Because I want to help you get over here, and I just want to listen and see where you're at and why, and how can I help you get to the other side of the curve. That 2-minute conversation or 10-minute, whatever it might be, will save you so much time and headache. So I think it's going to be a little bit individualized. Now, there's sometimes when you got to make decisions for your corporation or your team or whatnot, your hospital, that are non-negotiable. So you got to get there quicker. And you just might have to say, we have to do this. I need you on the right side of the curve. What can I do to get you there? Because we got to get there. We don't have a choice. So I think it's very individual to the change that you're trying to evoke. And understand, not everybody's going to be on the right side of the curve. And that's okay. But if you, as a leader, as a business owner, you are able to identify where someone's at and you get to the root cause of the problem. And then once you have that problem identified, you're able to fix it. So it's just great talking points. Okay.
Hi, good morning.
Good
Enjoyed
morning.
your presentation,
Thank
but
you.
I want to get to that 40%.
Yes. Okay. Colin Powell.
So to get to that 40%, since you are in electronic medical records,
Yes.
I would like some example, a case example of your experience where you have deployed Lean to improve the processes.
Yep.
And I want to remind everybody, it doesn't improve the EMR. That's the technology.
Amen to that. Yeah. No, it's that is
So
true.
if you can share that, that'll be great.
Excellent. Well, I think so your question then is to how do you use EMR to measure or
How did you do something with the process
okay.
in deploying EMR that was measured and made an impact?
Okay, great question. I can't give you a complete answer. I can give you half and half of an answer. Okay, so the 40%. I love it. So just something to know just about me personally, I've been in EMR for only 4 months. So, it's fascinating to me, though, because it is very metrics driven. And part of my career path is to really exercise my project management training. In a sales function, you can't always do that. So my goal was to take my training and my healthcare background to my customers and be able to offer more value. But I can share with you different things that, ways in which I have in the past measured the goal. So if it's in a particular project. So this was my team in North Carolina, Carolina Tide, and these are my folks that were on my team. And at this particular time frame, we were measuring certain targets or whatnot. And in that, we wanted to hit a certain number. The number here was 80%. So with that, every week during our cadence calls, they report back the number to me. So it's that human. This was some of it was human behavior. Some of it was hard and fast call metrics and whatnot. In EMR, the great thing about whatever platform you have, you're able to pull out so much data. Hopefully, if you've got a good solution, then you're able to pull out the data that you need to make informed decisions. So it really depends on what you're measuring, because it's a little bit of a loaded question in that it depends on what you're measuring. So if it's meaningful use, so if you want to, you got to get to a certain percentage on meaningful use, you want to make sure that your solution has great dashboards to be able to give you the quick, this is where I'm at, I'm tracking here, I'm not tracking there, and be able to have those sorts of dashboards to keep you on track. And a lot of them are sophisticated now to do that and give you those dashboards that you need. So we can have a one-off, and I'll share some more examples for you. So, but and again, Colin Powell is not, his statement, his wisdom is not necessarily part of Six Sigma per se. It is just something, it's a rule that I've lived by and have made some good decisions because of it.
Let me add to that. In IT, there's a journey, there's no destination.
Absolutely. Well,
And to that destination, perfection is an illusion.
Yeah, absolutely. I think you're right. I mean, there is no, Someone was, we were talking this
That
morning.
was a statement, not a question.
I
All right.
love it. I love it. You are right on.
But on your journey, can't you reach excellence along the way?
You would think you are excellent, but when you're there, you'll find there's more to go.
So continuing
Continuous
to reach
improvement.
excellence.
I love it. Continuous improvement. Great.
Any other questions at this point? Yep. Thank you.
My question is, all these measurements and metrics from working in corporations and mentality, they all seem to be generated to measure negativity and defects to find repairs.
Right, right.
Do you have any experience on finding positives for positive reinforcement? Because the connotation for this curve
Yes.
is generated because of the studies that are generated. They're always generated to find out who's not doing their job, who's unsuccessful, where you're unsuccessful, versus finding the successes along the way.
Yeah, I think that's that top-down leadership, and I think it's individualized. Absolutely, Lean Six Sigma shouldn't be viewed as negative. A lot of times, because the way we do scorecards with red lights and green lights and whatnot, that it can sort of have a negative connotation. I think it's the conversation that you have when you're rolling it out, and you're having these discussions with your staff, and helping them. So starting with your conversation with them to put a positive spin on it, that this isn't bad. We're measuring this because we need to get better. We want to be more efficient. We want to, job security, whatever, so to put that positive spin on it yourself, I think it starts there. But I think it's just the perception and uncertainty. Uh-huh.
Efficient. We want to
Yes.
find this. Which is saying to them, you're not efficient.
Yes.
You're not producing. You're not.
Right.
In the manufacturing industry,
It's easier.
you're not making
right.
good parts.
Right.
You're making defective parts versus we want to see how many
That's right. It is
good parts you're making.
and it's tangible, so it's easier. It's not easy, but it is easier in terms of the conversation you're having in a manufacturing plant than having with a team of healthcare professionals. So the key is, you can tie it back to everything that's going on in our industry because of all the things that we're accountable to, measure patient satisfaction, all those things that this is what your staff signed on for, to be in this industry. And so these are the things that we're being measured on. So how we get there is critical, but start with a conversation, and then let them know, no, this isn't personal. It's not to hurt anyone's feelings or to call you out and say you're not doing your job. We're all in this together. So we're just trying to understand and root cause. We don't want to point fingers at anyone. We just want to get to the bottom of it so that we can move forward and have a positive impact for our office as a team.
Okay, we got a question over here.
Okay.
How can you help with the reinforcement, the positive reinforcement beyond just the opening remarks and putting
Yes.
a more positive picture frame around it,
Yes.
if you want to say?
I love it.
Is there something that you can do so that the ones that do perform well,
Yes.
that's what I'd like to know.
Absolutely. I'm going to bring this up, and I know this is going to be recorded, so I probably should have taken the names out of here, just for, I know, right? So you don't know who they are anyhow. But so this, and that goes back to what a scorecard is, and I was remiss because I didn't spend a lot of time there for lack of time. But to have a scorecard to be able to measure, so whatever it is you're measuring, if it's patient satisfaction, and you can do that in the way of surveys on the front end, what their expectations are, the patient experience, customer experience, different ways that you can measure that. So you'll have surveys and maybe 5 questions in that survey. So you're measuring how was your wait time? Were you satisfied with the triage? Whatever you're measuring, you've got these questions. We refer to a friend, simple as that. So then you collect your data, you get your surveys, and if your goal is to be at 80% or higher in a certain, 4 and up, and however you set your range. Then as you're tracking and you're collecting your data, then you would set your cadence around how often are you going to track it, monthly, bi-week, bi-monthly, however, and then you're going to score it. So it would be red or green. If you're rolling it out to a team, let's say you guys are rolling out patient flow in the office, and so you're measuring how much time a patient is in triage. And so if they're there too long, then you go back, then you're able to go to your triage folks, your nurses, and say, we're here a little bit longer. Let's understand why patients are here a little bit longer than we'd like for them to be in terms of flow. So then you're going to fishbone it, right? And you're going to bring everybody in a collaborative way instead of Hope did it. She's the one that's bringing us all down. She's the one keeping everybody here longer. You're going to understand, and when you start to do these exercises as a team, they do come across very collaborative. But it's important when you are rolling it out, the words that you use, and not always just the words you use, but how you say it, is equally as important as what you say. Again, it doesn't have to be all smiles, but you have to seek to understand instead of seek to blame, and that's critical. Absolutely. I'm all about rewards. I'm in sales. No, I'm kidding. I'm totally kidding there. No, I think absolutely when you reward your staff, and sometimes a thank you can go a very long way. It doesn't have to be a monetary award, but certainly, I think thanking them, rewarding them, maybe an email, something of that nature. Absolutely. I love it. I'm signing on. I'm coming to work for you.
Any last comments or questions before we put it to the open forum on LinkedIn? All right, well, let's give it up for Hope Zonca.
Thank you, guys.
The discussion will continue on our open LinkedIn page, so make sure you vie for some discussion there. Bring up some other comments that you were too shy to lift your hand and have Hank come over with a microphone. Make sure you get on our LinkedIn page. Certainly we're here for the duration, meaning that you don't have to run off. You can stay and do some networking. You can meet some of the providers or vendors. And I have to say that when I started reading this and I felt it was all over my head, what I learned today, and I think most of the sales professionals out there will agree, we've been doing many of these different MODEVs or things all along, trying to find out what the need or the problem is in a company, coming back with a couple different suggestions, and then later on verifying and making sure that it works. So I've been doing that in telephone communications, and I have to believe that many of us out there are using this daily, just didn't know there was some silly acronym that went along with it. With that, I'd like to thank you for attending MOROF. Please don't run off. Make sure you meet one another. And again, Hope, thank you very much.
Thank you, guys. Thank you.